So if everybody's ready, I think we'll open up the special council meeting for Wednesday, August 26th. The roll call show, all counselors are present on Zoom. And the first item is a public hearing to consider adoption of an emergency ordinance requiring persons to wear face coverings in the town of Orono and requiring residential housing complexes to implement operation plans during the public health emergency and recovery. Before we start this, Belle and I worked through a few ways to hold the public hearing, and what I'd like to do is I have the attendees up on my screen, and if someone raises their hand to speak, I will ask Belle to let them do what she does to make them be able to speak. We will also have on the screen a timer for 3 minutes, and we will ask everyone to stay within the 3-minute time period, and then Belle will mute you after 3 minutes. And if you could, for the attendees, if during the public hearing, if you could state your name and your address for record. So, but before we start that, we're going to have Sophie give us a little bit of a presentation on it. So I'll turn it over to Sophie.
I'm going to try to share my screen. What have I done? Okay. Give me just a second. And Chief Lowe should show up here because he's going to help me with this today, so it's not just all me talking. I wanted to just briefly go through kind of what our objectives are for the public hearing. So counselors, if you don't feel that we have met these objectives, you got to come back and ask me questions, because first thing we're trying to do is make sure that everybody's on the same page with COVID-19 as a public health risk. So we're going to have the fire chief talk for a couple of slides about COVID-19. We're going to briefly review where we are right now with Governor Mills' declared civil state of emergency and the related executive orders as they relate to town action. I'm not going through all 55 of them. We're going to talk a little bit about the scope of council authority, so where council gets the authority to consider this action. Going to go through the very general elements that apply to all of the ordinance options in front of council, and then go into the specifics of each ordinance option, how each of those options are different. Then my time will come to an end unless people have questions, and it will turn around for the town council to have an opportunity to hear from the community. Is that, we're all on the same page? Okay. So Jeff, I think this is you.
Let me see where we are here. So yeah, this is just a general recap about COVID for anybody who hasn't heard our spiel yet or has some continuing questions or whatnot. Basically what we're talking about is COVID-19, which is the virus that was identified late last year and landed in the United States earlier this year. It's certainly a threat to the older population, especially those that are immunocompromised or have some other type of pre-existing medical condition. It's also a threat to some of the younger population, such as children and whatnot. Although the data isn't really clear just yet as to how it affects the younger generation or how much they carry it versus showing symptoms, when they do tend to have symptoms, they tend to be very dramatic and end up with inflammatory processes and those types of things, which can cause a lot of problems for kids. Certainly mainly, excuse me, certainly mainly spread through respiratory droplets. And that's why we're wearing face coverings and we're looking at the 6-foot separation. But you can also get it through secondary contact. So just like influenza or any of the other noroviruses that are out there, if you contact a doorknob, if you stick your hand in a bag of potato chips that somebody else has been eating, handrails, whatever the case may be that's infected with one of those viruses, and then you touch your face, touch your eyes, nose, you can end up with contracting the virus through that way. So surface contact is still a concern for spread, which is why hand washing and whatnot is still out there. Not everybody that has COVID is showing symptoms. There are pre-symptomatic and there are also asymptomatic people out there. So you can have COVID virus that is spreadable. And CDC is suggesting that up to 60% of people who contract COVID virus get it from people who were either pre or asymptomatic through the process. Recently, CDC put out some information talking about, there's a low number of people that are actually asymptomatic. That number has been rolled back. So there's really still a lot of confusion and misunderstanding, I think, or lack of knowledge relating to exactly how prevalent asymptomatic people are and what their exact role is in the spread of the transmission. So right now, 60% about is the number CDC is leaning on, but that is always subject to change. So what they're continuing to tell us about protection from COVID, protecting ourselves, factors that can affect whether you get it or not, has been consistent since day one. And when I look at this, it's very similar to how we deal with hazardous materials or ideological or biological agents that we deal with in the hazmat world. When we look at time, distance, and shielding to help prevent contracting or being exposed to the virus. So distance, which is the 6-foot distance or more if you can get it, is certainly important. I'll jump down to the bottom, which is use of face coverings. Certainly face coverings to limit the spread of droplets when you cough, sneeze, speak are proving to be a worthwhile endeavor. So even the cloth face coverings, which are subject to scrutiny or are often talked down, do provide some level of protection. There's just no doubt about that. I think the middle bullet there, length of interaction, is particularly important to this council, especially when they're going to be making some decisions later on this evening. And length of interaction, typically with CDC, as it relates to COVID, is usually 15 minutes or more. So what that would indicate to somebody who's going to make a decision like you are later on is you have to look at the environment that you're working in or working with, the environments that you're looking to set policy for, and decide in those environments, is your length of interaction really going to be 15 minutes? Will it be 10 minutes? Will it be 5 minutes? I would put forward to the council to consider that if we were in an environment such as Old Orchard Beach or Portland's Old Port or something along those lines where crowds tend to congregate outside, or there are long lines to get into a particular facility or whatever, then I would expect that you may see wait times of 10 minutes, 15 minutes, or what have you. It's not likely, based on the rule of length of interaction or time of exposure, if you will, that as we're walking by somebody on the street or passing on a sidewalk or what have you, that length of interaction is going to be enough, especially if you're outside, to contract the virus. I'm not saying it's impossible. I'm saying that understanding duration is an important consideration for you when you make this decision later on. So I think that's the big three there. So again, just the standard guidance that we have when we're talking about limiting spread of COVID. Number one is and has been wash your hands. Hand sanitizer of 60 to 70% alcohol if you're not able to wash your hands right away. And then as soon as you can, wash your hands. Warm water, soap. We want to bring the soap to a lather. and we want to wash for at least 20 seconds. And that's humming the happy birthday song twice to yourself, probably not out loud so people don't think you're crazy, just to make sure you've got the accurate or the correct duration of washing. Again, close contact, especially if they're people that are not in your household or what we would call a cohort. 6 feet of distance is a good guideline. Most droplets, most of the heavier droplets are going to drop within that time frame. You can still get a little overspray beyond that, but ideally the mask or whatever will help eliminate as much of that as possible. When we talk about cover your mouth or nose with a cloth or a cloth mask, face mask, whatever you have, again, that goes with that 6 feet. If you're not able to maintain 6 feet, that face covering is really essential to help limit that spread of virus. And again, it's not so much protecting yourself, it's protecting other people, so that if you are an asymptomatic or pre-symptomatic carrier, you're not sending that out. Cough and cover your sneezes. What we're talking about is coughing or covering into the bend of your elbow. So even if you have a mask on, that extra layer of protection will certainly will help you a little bit further. And it's important if you're dealing with family members or stuff like that. Clean and disinfect frequently. You know, in the town office, we have policies that reflect what healthcare organizations are doing with frequency of cleaning and high contact areas and those types of things, the way we have separation and whatnot. So clean and disinfect, not only in your workspaces, but if you're at home, you have people over for whatever the reason is, even if it's family members outside your regular family unit, do a quick clean to start with, and when they leave, go ahead and do another quick clean. Not because they're dirty people or whatever, but the intention is to try to clean up all that aerosolized droplet material that may be coming out of your mouth or whatever the case may be. And then lastly, or one of the other things here is monitor your health daily. You want to pay attention to what's going on with you, how you're feeling. Are you developing symptoms that you don't normally have? Have you developed a cough? We talk about loss of smell and taste, but there's a whole host of other symptoms that have started that are also related to influenza, like fever and chills, nausea, vomiting, gastrointestinal issues, those types of things. As we're coming into flu season, which typically starts around October and will peak sometime around January, February area, there's going to be a lot of concern as to whether or not people have influenza or do they have COVID. So being attentive to what's going on with you and not ignoring those symptoms is really, really important. Some additional steps that you can do to help prevent you from either contracting corona or influenza or one of the other noroviruses. At the end of the day, they're all viruses, and these all apply across the board. Number one is drink water, or drink flavored water, or whatever it is that you happen to have. The idea behind that is water's important. We know that we're mostly made up of water. Water is essential for cellular function. It's essential to maintain cognition. It's essential to flush wastes out of our body. So when our body is attacking that virus, it has to go somewhere. And part of that excretion is through water when we urinate. So drinking water is very critical. 2 liters a day would be ideal. A gallon a day would be great, but whatever you can get into you is really important. Second thing, when you're dealing with this stuff, especially this time of year, getting on some type of regular sleep cycle is critical. Your body needs time to heal. It needs time to work. Having rest will help reduce stress. And we'll talk about stress in just a minute, but trying to establish some type of healthy rest cycle, especially with everything that's going on with coronavirus, the disruption in the nation and the political atmosphere, everything else, getting on some type of regular rest is really important. Eating healthy, again, you've heard this on and on and on about eating healthy, making sure you're getting enough calories, but you have to also make sure you're getting the right kind of macros like vitamins and all those types of things. Don't let non-COVID illnesses linger. You need to make sure that you are you're taking care of yourself. Whatever you have now, if you get something else, it's just going to make it worse because your body's already fighting something. Take time for yourself. World Health Organization just put an article out yesterday that talked about the infodemic. And what they're relating to is the fact that there's so much disinformation, misinformation out there that they are fighting against that as well. So don't fall victim to those types of things. Take a break, take a rest from the news, take a rest from all the negativity, relax, find some time for yourself to kind of heal yourself and ground yourself. Last thing is use a humidifier in your home, especially when things are starting to dry out. You want to make sure that things are humid. It helps your body heal. It'll help you repair things that are going on inside. So those are some additional steps that you can take. Sophie?
So when we think about COVID-19 hit and it created a unique circumstance for us. On March 13th, President Trump declared a national emergency. Governor Mills followed right behind that very quickly on March 15th, in which she proclaimed a state of civil emergency, citing COVID-19 as highly infectious and that it posed an imminent threat of substantial harm to Maine citizens. So beginning on March 18th and continuing through to the present, I think August 4th was the last executive order she issued, but she's issued approximately 50 executive orders that are either direct action or restrict action due to this particular civil emergency. Council will remember that when this started, we really relied on those state orders because we do not have a civil emergency powers provision in our ordinance. We have an emergency provision, which is where we are today, but we don't have the authority for council to just restrict people's rights or create legislative requirements through a simple council order. So right now, when we think about the government, we need to think that the state creates its rules. We have the ability to be more restrictive than the state, but we can never be less restrictive than the state. So just by virtue of the governor's emergency orders, right now, there's a limit on the number of people that can gather outside to 5 people per 1,000 square feet of occupiable outdoor space, but no more than 100 people. So whichever is less. And it's 50 people in an indoor gathering. If you recall, she has orders that also speak about social distance at 6 feet. She also goes on to talk about face coverings and the fact that we are supposed to be wearing cloth face coverings in public when social distancing is not, we're not able to maintain social distancing. It is what we found, at least at town hall, is that 6 feet is a perception because you don't run around looking at, we don't carry a stick that's 6 feet long, and we don't have markers every, like cubes on the floor. And so sometimes it is difficult to remember where your 6 feet is. It also requires face cloth coverings to be used in some indoor establishment. Places that were open, businesses that were open for the public were supposed to create some visible signage and require that people wore face coverings. So there are some exceptions to face coverings. The state has been through a couple of iterations of this, but it's what they're saying is children, young children, it's really hard to keep a face mask on a young child. They are now at the point where young children under the age of 2, between 2 and 4, I'm sorry, under the age of 2 are not required, and older than that, they are required. There's been some guidance that's come down that said the adult with them just they need to be making every reasonable effort, but we understand that young kids many of them are not going to want to have face masks on. So the state tells us exactly what a face covering is supposed to be. It can be disposable, it can be homemade, it can be fabric, it can be a face shield as long as the face shield extends below the chin and covers the ears. The final thing that she has done in her directives is she specifically, so as council is aware, in our home rule authority, this state can preempt us from further regulation. So if they take an area and they regulate it, the argument can be made that the state's already made the determination and the town can't come in and do any more. In this particular case, she has been explicit in her emergency orders, executive orders, to authorize municipalities to take further action. So let's talk about, I'm not going to talk about all municipalities. I'm going to talk about Orono because that's what matters today. Well, I think it matters every day, but the town council has power to take action like this, and it comes from a few different places. The first is in 30A, we are vested with home rule authority. The state of Maine has empowered municipalities to enact their own rules as they see fit, so long as they are not less restrictive than the state and they do not venture into areas that the state has preempted from additional regulation. In Orono, we have a town charter. That town charter is what created the town council. The town council acts as the legislative body for the town of Orono. There is very little by way of power that sits outside of the town council in Orono. This charter specifically vests the ability to enact ordinances with the town council. The town charter also, in section 112L, gives you the ability to shortcut the ordinance process in the case of an emergency. And that we'll talk about that in a few minutes, why that's important. And then again, executive order explicitly empowers you to manage face coverings on a more restrictive basis. So when we talk about public policy, which is what we're doing today, right? We're looking at ordinances, which is developing a public policy. We are trying to find a balance, or council is trying to find a balance. And on either end of that spectrum is public health, safety, and welfare balanced against people's personal freedoms and property rights, right? That is the balance that we are constantly trying to find. So when this public health emergency started, council relied on the state and the scientific information that the state had to direct us and help us find that balance. With the university coming back in session and the town population and activity increasing, the town council received concerns from a number of citizens about the fact that they did not feel safe walking down the streets in Orono. So that is why we are here, trying to evaluate whether or not the current balance of relying on the state's, the governor's executive orders find the appropriate balance for the town of Orono between public health, safety, and welfare and individual freedoms. So what you're going to notice, if you haven't already, is that this ordinance is offered in 4 different options. And the reason for that is that the town council has to give an up or down vote to an ordinance. They cannot amend it. when Roger and I tried to break this into 3 different sections, we were having all sorts of trouble because it really, the ordinance has to, it relies on elements within the ordinance, so it's got to be a complete document. So I'm going to go first through the general ordinance provisions. So this would be the same regardless of what option you adopted. And then after that, I'm going to go through the 4 options that are on the table tonight. If council wants to create option E, we can talk about that, but that would have to have its own public hearing and discussion and debate later on. I can see Cheryl and Tom. I'm in good shape? Okay. So in general, all 4 of these ordinances creates a finding of the town council that there is a need for action to protect and promote the general health, safety, and welfare of Orono residents and to limit the spread of COVID-19. So if a councilor does not believe that that is in fact a reality, you should not vote for any of these ordinances because that is your emergency finding, okay? We also go on to describe a face covering as a piece of cloth, fabric, or other material that fully covers the mouth and nose and that is secured using ear straps or otherwise tied as so to prevent slipping. A face covering may be factory made or may be handmade and improved from household materials, but it must meet all CDC guidelines as may be amended. Face coverings include respirators and 95 masks or other personal protective equipment that provides a higher level of protection than face coverings defined by this ordinance. A face covering shall be worn so as to cover the mouth and nose in compliance with the CDC's guidance on wearing face coverings. I went through the process of reading this whole piece because this has changed due to some citizen input after our last meeting. And what has changed here, if you recall, this used to have a laundry list of all different sorts of masks, face coverings. We have taken that out to give a more general description and then say it's got to meet CDC guidelines. So if CDC guidance tells me that my bandana is not good moving forward, or my face shield is not good moving forward, or needs to be worn in a specific way, this ordinance would revert to what the current CDC guidance is. Make sense? Okay. The other definition is a residential housing complex, which means any development containing 100 or more residential dwelling units as defined by section 18-31 of the Town of Orono ordinances. So these are very large housing complexes, most of which are shared and congregate living, which is a little bit different than a traditional apartment building. So all of the ordinances have these same exceptions for face coverings. So if somebody is unable to wear a face covering due to a medical condition, a mental health condition, a mental disability, if they're unable to remove a face covering without the assistance of others, or if they should otherwise not be required to wear a face covering under CDC guidance, they are exempt from wearing a face covering under this ordinance. An individual is not required to provide us with like a doctor's note or other documentation. If somebody is traveling in their personal vehicle, their assigned vehicle, they by themselves, they do not, or in their household cohort, they do not have to wear a mask or a face covering. If they're exercising, so doing strenuous activity, they must maintain 6 feet of distance at all times from others, but they are not required to wear a face covering. In restaurants and bars, while they're eating and drinking, they don't have to have a face covering. If they're in an outdoor area or unenclosed area, adjacent to, pertinent to a retail or food service establishment, when 6 feet of distance is possible and observed, they do not have to wear a face covering. A person whose religious beliefs prevent them from wearing a face covering is, they are exempt. Children under 6 years old with reasonable efforts by an accompanying adult with children aged 2 through 6 to make them wear a covering in a retail or food establishment. If they are working without any face-to-face interaction with the public, you don't have to wear a mask. If it's not feasible to wear a face covering, like when you're swimming or having dental work done, you don't have to wear a face covering. Whoops. When you're complying with the directions of a law enforcement officer, you don't have to wear a face covering. And when first responders are responding or engaged in an emergency and it's not practicable, they do not have to wear a face covering. Day to day, when they're out and about, they are required like everybody else. So residential housing complexes are required to provide a written plan to the town within 7 days for approval by the fire chief. That plan needs to be based on a template that will be provided by the town, and councilors have seen a copy of that template. Everything that is required conforms to CDC's guidance on COVID-19 prevention and response for shared and congregate housing facilities. So when we look at whether a plan is approved or not, it's based on CDC guidance. The penalties are the same in all of the ordinances. People not wearing a face covering, first it requires a warning before any offense. $100 for the first offense, $200 for the second offense, and $500 for the third offense. And as we talked with council, the goal here is not to be out writing tickets and penalties. The goal is to find voluntary compliance. And as I spoke with an individual from the media earlier this week, every single ordinance in the town's code of ordinance has an enforcement and penalty section. So there are fines associated with all of them. We only fine people for those penalties that are absolute priorities. And what we have heard here is that the goal is to educate and seek voluntary compliance. So there are fines here for not wearing a face covering. Our hope is that we wouldn't need to go down that road. Residential housing complexes, if they fail to submit a plan within 7 days or to enforce the plan that is approved, it is a $1,000 per day per violation fine. The other provisions, the enforcement would be by the town manager or designee, and we talked with council quite a bit about the fact that given the current environment, our goal is to have our police department being ambassadors for education as opposed to enforcement entities for face coverings. The duration of the ordinance, so unlike other ordinances that the council would enact, this is not a permanent ordinance. This is one that stays in effect until 30 days after the state of Maine civil emergency expires, or if council takes a future action to repeal it earlier than that. And the effective date is immediate. Does anybody have it? I don't know how you want to do this, Cindy, but do you want me to stop if counselors have questions, or are you happy for me to just keep going with the options?
Why don't you keep going with the options, and then we'll take questions if there's ones after that.
So option A requires that face coverings be worn in all public places, so indoors and out, including sidewalks, streets, parks, and right-of-ways within the boundaries of the town of Orono. It also, along with all those other things that we talked about, it requires businesses to enforce the wearing of face coverings in their establishments. So the town would be working with businesses for compliance. And residential complexes are required to submit a plan and enforce that approved plan. Option B, face coverings would be required in all public places, indoors and outdoors, including sidewalks, streets, parks, and rights of way within the required to enforce the coverings in their establishment to any degree other than what the state requires. And residential complexes would be required to submit and enforce an approved plan. Option C. Option C requires that face coverings be worn in public spaces, including sidewalks, streets, parks, and rights of way within a specified zone. Let's just call that the village zone for right now. I have a picture that I will show you, as well as along College Avenue, and that would be from Main Street all the way to the town line, and Park Street from College Avenue to Black Bear Lane, which is the entry to the reserve. Businesses would be required to enforce the face covering elements in their establishments, and residential complexes are required to submit and enforce an approved plan. So when we look at option C specifically exempts any land or property under the ownership of Regional School Unit 26. I think an argument could be made that option A and B would as well. But for this, it is explicit. I can tell you from an enforcement standpoint, I would not be looking to enforce in option A or B any of these requirements on RSU 26. So this is the picture. If you look, we took 1/4 of a mile from the Mill Main intersection and went out along the road. So the roads and parking lots are in yellow, and the seafoam green would be parks and trails that would also fall under this in this zone. So we have the Village Green, the community gardens, the Summer Street Park, and part of the Stillwater Trail. Option D requires face coverings to be worn in all public indoor places. So indoor places that the public frequents. Businesses would be required to enforce wearing face coverings in their establishment, and residential complexes would be required to submit and enforce an approved plan. So that's what I have for my presentation. I don't know, you want to answer questions before comments start, or do you want to move right to comments?
At this point, why don't we just ask any of council if there's any clarifying questions that they have? I can't.
Yes, I have one. One of the things that we didn't talk about the last time, mostly because CDC guidelines have shifted as they are wont to do, is the face covering, you know, how the face coverings are changing and kind of morphing. We won't be micromanaging people's face coverings in this ordinance, is my assumption.
I work really hard not to micromanage anything, Cheryl, but
I know.
I think the thought is if somebody had something that was blatantly not at all, you know, somebody takes a tissue and tapes it to their face, we might have something to say. I don't imagine that any of us are going to become the major experts on what makes up a face covering. I think our thought is, I don't have enough. I barely have enough staff. Probably don't have enough staff to enforce this ordinance. We're going to give it a college try with trying to seek voluntary compliance. But I think that CDC guidance is really pretty open, Cheryl, as long as it meets the straight face test. I think that's all we're kind of looking for.
Good. Thank you, Sophie.
Anyone else have any clarifying questions?
Yes. Sophie, do you mind talking a little bit about and the differences between, say, for example, option C and option D? It sounds as though the way that it's written in option C, the requirement for businesses to enforce, it sounds like it's in the zones, whereas outside the zones, no, or is that incorrect?
I would, give me just a second. In the zones, so, in the zone, there is indoor and outdoor, and that is mandatory, both inside and outside. But anywhere, even outside the zone, if you're inside a place of business that's open to the public, you are required to be wearing a face covering. And that's section 4A1, Megan.
Excellent, thank you.
And businesses would be required to enforce that.
Anyone else?
Yeah, so how is it that the business would be enforcing that?
Asking people to put on face coverings. They would be making every effort to put on face coverings. When people weren't, they might call the town for assistance. It's more a matter of saying that people can't just walk into a business establishment and not have a face covering on and be allowed to, and not meet one of the exceptions and be allowed to just hang out. And it's a way for the town to be working with the businesses to seek enforcement, as opposed to taking our limited resources and trying to manage what's happening inside individual businesses.
Go ahead.
I know some businesses have expressed, a lot of businesses have been great about enforcing this. A lot of businesses have been, especially larger businesses, have been providing masks to their patrons to help them out, to help them comply with this. I've seen that a number of places. That may be a hardship for some businesses if we were to go forward with this, and this may be putting the cart before the horse. And given that we have received some grant funding, I believe, in response to our code, would we be able to assist businesses with some sort of disposable mask type thing if we were to go in this direction?
So I know that one of our goals was to have masks to distribute. That takes a little bit of time for us to get, but I think the plan is to have them. As long as we have them, I think we could absolutely help businesses that are having issues. I just wouldn't want to guarantee that we would be able to do it after our grant funding expires for that purpose.
Sophie, could you just explain if Governor Mills has included our town in the face mask requirements?
Well, I really wish I could. So we issued a letter to Governor Mills explaining that our population was shifting and that we had several citizens with concerns. We had asked that she consider placing some requirements on college towns in general in Maine, specifically also Orono, that would require people to wear face coverings inside. I was told that that was probably going to happen. Well, actually, I was told it was going to happen, and was asked for some documentation to back it up to show that it really was our request. I have not heard anything back. So I cannot tell you, Cindy, what is going to happen with that.
Okay.
But that would have only been indoors.
Yeah. Okay.
Go ahead, Cindy. I just have one more question, but go ahead, Cindy.
No, go ahead. Then I thought I would open it up to the public.
My last question, Sophie, is about our farmers market. I know they're requiring face masks and they are outdoors, or coverings. Are they considered a business?
No, well, I'm not even going to try to define that.
Okay.
But what I can tell you is farmers markets have their own set of guidance that have been issued from Maine CDC and the Department of Economic and Community Development. For those sectors, for an establishment like that, unless you, if you pass saying anybody within Orono, inside, indoors and out, have to wear masks, then everybody has to. But for that, I would revert to the guidance that is specific to farmers markets.
And if just a follow up, would that still fall under option D, so that we would still have there? You would still, as in an outdoor place, you would still be required because farmers market requires that.
Yeah. So option D does not remove any of the existing requirements. It just says the layer that we're adding onto this is everybody indoors has to wear, in a public place, has to wear a mask. Businesses have to make every effort to enforce that provision. And the residential complexes need to create, submit, and enforce an approved plan.
Thank you.
Thank you.
One more question, Cindy, for me, just regarding residential complexes. I know there's been some communication generated by the town with them. Have we had any communication return?
Yes. We now have a third party, a contract that demonstrates that they have third party security. It is our understanding that they have stepped up enforcement. The police department went there this weekend, and were actually seen as the good guys, which is wonderful. And that we seem to see some enforcement efforts happening. So that makes me, I was glad to see that.
It is good news. Thank you.
Okay. If
Do you
we
want
are,
me to?
yep. Go ahead, Tom.
So Cindy, do you want me to go through this? How we think we're gonna use the,
Sure.
all right. So for tonight, council's gonna launch a poll at the end of the presentation to allow attendees to vote for their preferred option. So people are encouraged to respond to the poll even if they intend to speak. This will give you a sense of the sentiment. Attendees who wish to speak must use the raised hand feature of Zoom. I gotta just move this real quick. After the chair recognizes an attendee, the moderator will activate their ability to speak. Attendees must unmute their microphones in order to speak. Once an attendee can speak, a 3-minute timer will start on the screen. At the end of 3 minutes, the attendee's microphone will be muted. Comments should add additional information to the conversation, not merely repeat what others have said before you. Inappropriate comments or language will result in being removed from the meeting upon order of the chair. So Cindy, if you have to order Bell to do that. The chat function will not be available for attendees. An opinion on the ordinance must be expressed utilizing the poll and/or speaking. And that, I'm going to stop my screen share.
Okay, great.
Well, that's no fun. I can't vote.
Nope. Either can counsel.
I'm going to mute.
So we have a couple of hands already raised. So if we're all ready to move into the public hearing, then I will start with Ron Davis is the first one on my list. If Bell, if you could unmute, talking permitted. So go ahead, Ron.
Am I unmuted?
You're unmuted. Yep.
You can hear me. Good. I have a question for Sophie first, and then a comment after I get the answer. Sophie, can you hear me?
I can.
You mentioned something at the beginning when you were discussing provisions that apply to all of the options about people congregating outside of businesses not being required to wear face masks. Could you clarify that, please?
Yes, because that's, if I said that, that is not accurate. What everybody, face coverings that are required in public spaces, this would be, are required while entering and inside a place of business open to the public. And in others, while acting or interacting with others in outdoor spaces, including but not limited to curbside pickup, delivery, and service calls, when providing or utilizing public or commercial transportation, and when participating in a permitted or allowable gathering. That is for A, B, and C. And in D, it is the same.
Thank you, Cindy. Sophie. I believe that on Orono sidewalks, most of the sidewalks are narrow enough so that it's impossible to be more distant than 6 feet from someone. And in terms of state guidelines, I wonder whether that would be a situation where a face mask is recommended. And also, in regard to the fire chief's comments, which I really thought were excellent, I would simply point out that duration certainly is of exposure is certainly an important factor in getting a infectious dose. However, the concentration of the virus in the air is another factor. So they both have to be considered. So if one were walking along parallel in the same direction to a asymptomatic carrier, one could not only get a long duration of exposure, but also could get a high concentration of the virus in the air that's being expired. I would favor option C, and I think that, or another version of that possibility would be to say the part of the town where there are established sidewalks, because I see sidewalks and also narrow public trails as problematic. And I'm also concerned about runners in the downtown area not being able, if they're on the sidewalk, to distance themselves. So those are all my comments.
Thank you very much, Ron. The next hand is for LCK. If you could identify who you are and state where you live.
Hello, LCK is Leo Kenny. I live 19 Page Place, Orono, Maine. Can you hear me?
I can, Leo, thank
Oh,
you.
okay. That came up automatic, so I didn't adjust it. So thanks to Sophie and the chief for the CDC guidelines and backgrounds. It sounds like the main driver for this is that we've received calls from residents, and I'm just curious, Sophie, if you're able to share, just a sense for what that number looks like as far as people calls that has driven this kind of action. It seems like.
So, Leo, I will tell you, I don't know that I've seen most of the interaction. I think most of that came directly through council. So I think that would be more appropriately moved to council. I've seen 3 or 4.
All right.
Yeah, it's been something, Leo, that we get comments on, as we're walking the streets or emails or whatever. So it's been something that's been quite pervasive in our community.
Is there anything quantifiable at all, or no? Just kind of.
Yeah, I don't think I could give you a number.
Okay. All right. Well, I do appreciate, obviously, people being concerned about the returning students, which I think is what's driving it. Correct. I think is what I heard. But I personally believe that the proposed emergency ordinance would be a complete overreach for council to adopt. And I don't really see what the potential gain is over the current state mandate either. Maybe I just missed that. So if someone wants to provide clarification on the major points of differentiation there, that would be great. But I think one of my other concerns, and actually, do you have a timer going on me? I can't see it. Yes, you do. All right. Now
Yes, we do.
All right. Thought you might have forgot. But one of my concerns, I guess, too, is that this is, well, that now that's a concern that there's no kind of number associated with the people that have called in. Obviously, we're a town of around 10,000, I guess. So I think it's relevant how many people called in with concerns. But the other thing is that it seems like there's not been any discussion this afternoon, at least, about basically the state of the disease, I guess, in our state. So I don't know if that data has been considered or looked at, but I did want to share just some from the Maine CDC for yucks here, because they always talk about the percentage of positive testing. And today you can look on the state website, and our average is down to 2.3% from a 7% high in the entire state. It's dropped steady since the end of May. And if you look at the individual months, versus the cumulative effect, August we're down to about 0.88%. So that's, the percentage of positives are way down. The cases are way down in the entire state. So it just seems like an odd time also that and I understand students coming back, but given the whole state of the disease, it seems like an odd time to be acting emergency. Am I cut off?
You will be, but we got your point. Thank you very much, Leo. I have Cameron Bowie next.
Indeed. Can the council hear my voice?
Yes, we can.
My apologies for any background noise. I live on the corner of Park and College, and it is noisy with all the passing traffic. I hope you all are doing well this evening. I mostly come with questions regarding some of the implementation of the ordinance. I'm in general support of it, and I duly hope for the health and well-being of our township throughout all this. My first question regarding the ordinance comes mostly as a logistical question. The fines that carry with the personnel fines following the first warning of 100, 200, and 500, they correspond relative to littering fines. And the nature of the revenue gained from those, where would that revenue go to?
So if we had any revenue, it would first go to help offset the expense, because my sense is if we couldn't get somebody to comply through voluntary means and it got to the point where we had to issue a fine, they're probably going to take us to court over that fine, because that's the way fine structure works in municipal governments. If they go to court, I'm going to spend far more than $500 to defend the issuance of that fine to collect the money. So ultimately, it would be a net cost to the town.
Understood. Thank you. The second question I had is regarding enforcement mechanisms. Naturally, our law enforcement officers are some of the best in the region. They've done a fairly good job. But, you know, in the event that a business is unable to ensure compliance, they'll be the ones directly interacting with individuals who predominantly don't have masks, as that is the nature of the ordinance, to fine and ticket people who are not following compliance with masking. As such, it puts them at a slightly higher risk to exposure, and it brings them back to their civil offices and putting folks like yourselves and civil servants at risk. And more importantly, if they then go back out into the environment of the town, they will be exposing themselves to more individuals who don't have masks. What are the steps the town is going to take to help alleviate this, and has the town considered additional funding and supplies towards this regard?
So I have my police chief online, and I would very much like him to answer that question. Belle, can you make that happen?
Josh, I need you to raise your hand so I can identify the correct person, please.
Hi, can you hear me now?
Yes.
So that's a great question. You know, I think we are generally put at risk, no matter when we're dealing with people, for a variety of reasons. So it's just another form of risk for us. We do have access to a little better masks, the N95 masks, which I suppose we could deploy if we had more concern about whether or not somebody was asymptomatic, but maybe carrying the virus, if we knew. I don't really have a great answer for you, other than we might go with the route of just asking somebody, using the idea of criminal trespass at that point and telling somebody to leave, rather than having to, you know, arrest them or summons them and bring them back to the station and just provide more exposure to them. We would just simply get them removed from the area. I don't know if I'm answering your question very well, because it was pretty detailed, and I don't know if it was more concerned about our safety or our methods. So
it's more concerned. It's my apologies for interrupting, but it is more concerned for your safety. I've known you for a little while, or I should say my father's known you for a little while, and I just want to make sure you all are safe.
Thank you for that. I think, and we are in the works of trying to come up with more access to N95 masks to give ourselves some more protection, but in the meantime, we're minimizing contact, and we're just trying to gain compliance. But I definitely appreciate your concern for us.
A third question. I know I have limited time here, so I'm trying to fit them in regards to locals who are dining in at restaurants and such. It has been common practice for individuals who seat themselves to then take off their masks. I've seen this en masse, both during my times dining at local restaurants and eateries in and around town, and also in selected communities around the area. Obviously, this ordinance on all options, save for one of the options, prohibits this. Enforcement of this ordinance would be left to the local business itself, save for one of the options. It would be a little hard to enforce, but what are the options for mass non-compliance?
I heard a few different questions in there. The first one is, I guess you and I see the ordinance a little bit different, Cameron, because I see sitting down, being stationary at a table as meeting the requirement to take a mask off. As to how people enforce it, I'm going to guess they do it the same way that we're going to be enforcing it, which is trying to seek voluntary compliance, trying to educate, and then if they have issues, they're going to have to call for assistance from the police department or our public health team.
Thank you very much, Cameron, for your questions and comments. We'll move now to Peter Haworth.
This is actually Sarah Howarth. I'm here with Peter, my husband. We both are residents of Orono, and we live on Riverdale Drive off of College, right near the university. And I would like to express my strongest support for option C. And I would also like to point out that some previous people who have commented have said that, you know, we're in pretty good shape in the state of Maine. We have low numbers. The university has a very, very good screening system set up for both symptomatic and asymptomatic. However, I think this ordinance is really crucial to completely shutting it down. We've seen across the world that people who have been in nations and jurisdictions where they've really strictly enforced mask wearing, social distancing, and limiting large gatherings have completely locked it down. So I'd like to see our children, we have 3 children in the school district, be able to get back to school as normal, as I'm sure a lot of our Orono residents would. And I'm sure businesses would like to see things get back to normal. So that is the comment I wanted to make. The question that both of us have is, once this is decided, if it is decided to go forward, how will this be communicated to both the citizens of Orono as well as the students at the university and the business owners? What's the communication plan?
So my plans are always open for change, but I would work with the university. We've already talked with folks at the university about helping us get the word out. So I would work with the university to notify students and faculty, staff. For people within Orono, I think the plan is to use all of our electronic media, our signboard, to convey a short message. And then although this is in effect, it would be clearly an education effort and voluntary compliance effort. We would then be looking at putting out postcards to all all residents, all households, there we go, to make sure that everybody understands what the rules are.
I have one further question. In the zone described in your presentation for option C, you mentioned that it went all the way down Park Avenue up to the entrance of the university, but what portion of College Avenue would it go through?
If I could just clarify, it goes, College Avenue goes from the intersection with Main Street, which is at the end of the bridge, all the way to the town line. So that ends right after Stillwater Village.
Perfect.
And on Park Street, it goes from the intersection of College and Park all the way to Black Bear Lane, which is the entrance to the reserve. So
Okay.
it goes beyond the university.
Because my question for that is, I know a lot of the fraternity houses are on that row, fraternity row, so to speak. And there's they're technically not campus residences. They're private residences that are leased by the fraternities. And I have particular concern about how this will be enforced and whose jurisdiction it would fall under, because the campus police, I don't know if it would fall under their jurisdiction or the Orono police's jurisdiction. And we've already seen some fraternity members who have tested positive.
So, just so you are aware, the Orono Police Department and the university, UMPD, have an agreement where UMPD makes first response to the fraternities. So it falls under campus, and all of the fraternities are sanctioned by the university. So the university actually has quite a bit of authority over the fraternities that the town would not have under any of these ordinances.
Okay. Thank you very much for allowing me to make my comments. I appreciate it.
Thank you very much. All right, let me go back here. Nadine Jones is next up.
Hi, can you hear me?
Yes, Nadine, thank you.
Thank you. Thank you all for your hard work. I'm Nadine Coda Jones. I live on Hamlin Street in Orono. I highly support this ordinance, and I have done a lot of investigating within my own little community, plus out the town of Orono and to the UMO. I took a ride up through UMO today and on campus, and I was just so impressed with what they're doing and how they're trying to make the students safe, our community safe, the university safe. And I just want people to know that the university is right on target. And they also, as you can tell by recent news articles, are really, really holding kids accountable, students accountable. The major concern I have right now is for our pre-K through 12th grade students. They need to be back in school, and the teachers need to be with them too, full time. And this is only going to happen if we keep mandating masks and being vigilant about it. Now, I've also watched different businesses, and there's only one business in town, and I won't name it, that hasn't done it, made students wear masks. And I think all store owners and businesses mandate masks or no service, that they will follow through with that. I commend the University of Maine trying really hard to keep it their students safe. So I think we need to support the students of pre-K through 12 and the students at UMO and our community. It's just very important that they all stay safe and we stay safe. So thank you so much for all your hard work, and I hope that we have this ordinance in place. Thank you.
Thank you, Nadine, very much. Doug and Fran?
Yeah. Go ahead, you're on.
It says you are muted.
You're on.
Am I?
I hear you now.
Okay, great. Thank you very much. I have a concern, along with Leo, as far as whether it's 1, 2, 3, 10 people that have communicated their issues, or whether it's 100 people that have communicated issues, or 1,000 people who have communicated an issue. But more than that, the CDC states that, and I quote, "Masks may help prevent people who have COVID-19 from spreading the virus to others. Wearing a mask will help protect those around you, including those at higher risk of severe illness from COVID-19 and workers who frequently come in, quote, close contact with other people." And the CDC goes on to define close contact as you are within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. I believe this is the defining factor. That 15 minutes, you have to be, if you are just passing them on the street, if you are strolling along with them on the street, but you are not conversing with them, you are essentially not in close contact. So just passing someone who is infected, even with COVID-19, even asymptomatic on the street, and you are just simply walking along, you are not going to be infected and you are not going to infect someone else. Again, you must be, according to the CDC, in close contact for a total of 15 minutes or more. I think we should practice social distancing. I'm not going around hugging everybody. I am not going around seeking out a close contact. However, I do not believe that we do need to wear a mask around town. I do not believe that we need to add additional rules to what the CDC has recommended, but simply to follow the established guidelines. Now, my husband has something he wants to add.
Can we reset 3 minutes for me, or am I stuck with 59 seconds?
You can set it for 3 minutes. While she's resetting it, would you mind just telling us your last name?
Yeah, Doug and Fran Palmeter. We live in right on Main Street.
Okay, thank you.
Okay.
Go ahead, Doug.
It seems to me I'm a little confused here, and that's tongue in cheek. This is an emergency, so it's an emergency unless you're exercising, but then it's not an emergency. It's an emergency if you're outside the place not eating, but if you go inside, it's not an emergency, so you can take your mask off. If you're less than 4 years old, it's not an emergency, but if you're older than 4 years old, it's an emergency, or it's an emergency if you're downtown Orono in the village, but if you're in the neighborhood, then it's not an emergency. It seems to me that I'm real confused here on what's an emergency and what isn't. If it's okay to do these, if it's not an emergency to sit inside where you have an exposure to other people, and we know restaurants is a high risk factor, that seems to be more risky than walking by somebody on Main Street. So I guess it's an emergency if you're on Main Street, but not in a restaurant. So can you clarify for me where the emergency is applicable? That's my question.
Go ahead, Sophie, you can take it if you want.
So I think the emergency is the risk to public health and safety that causes council to consider this ordinance. The concern around being indoors versus outdoors, being sedentary where you can maintain a social distance versus moving around where you cannot. If you look at the exercising language, there is a mandate that you must maintain 6 feet. I understand the point that you are trying to make, Doug, and the issue is in an ordinance, I can't regulate everything, so I'm doing the best I can.
It seems inconsistent, and it would seem sufficient to, if we're concerned with the 6 feet. I guess I disagree with what you said initially. I mean, when I walk in the morning for exercise, people give me much more than 6 feet, and I give them more than 6 feet, and it's not an ordinance. And therefore, we don't have the excessive regulation as well as the burden of trying to enforce that. Fran, do you want to add?
I just wanted to be clear that I am definitely not in favor of any masks outside.
So I guess in closing, if this is an emergency, then let's call it an emergency and let's go for it. And if it's not an emergency, then I'm not sure why we're passing these. I'm done. Thank you.
Thank you very much. Sean Burkell.
Yes, hello, this is Sean. I live on Shadbush. And first, I'd like to thank the council for their hard work. And I realize this is a challenging matter with varied opinions. I would just like to voice my opinion that I agree with the sentiment that it seems mostly unnecessary to have to wear a mask outside in public spaces, particularly on sidewalks where there is at most times plenty of space, and people have already been providing plenty of distance, 6-10 feet. And I support the efforts to try to keep indoor spaces safe, and I can support, for example, option D, in which there would be a mandate for wearing masks inside public spaces, but I oppose a measure that would require wearing facial coverings outdoors, especially without a very limited area focus. But so I'm in favor of option D. Thank you.
Thank you very much. Nancy Prisk.
Hi, can you hear me?
I can, Nancy, thank you.
Nancy Prisk, and I'm at 7 University Place. And I had a different experience to this. For the last few months, I've been in a coastal community where we have had quadrupling of our normal population. And the guidelines put out by the state, and I do monitor daily what the guidelines are coming out of CDC. The guidelines put out by the state, unfortunately, are not very well respected by people who don't actually live in the community. And then I'm not saying students would behave this way, but I do know that adults are very often behaving this way. So we have started an initiative here to encourage people to allow our kids to go back to school by keeping our community safe in a general fashion. And we have, as people who are not tourists, we have started wearing masks indoors and outdoors. Outdoors, and I fully respect if you're walking alone and there's no one else on the sidewalk to be able to slip it off. But the minute somebody comes near, we just respectfully put on a mask and say hi to the other person and keep moving until we're at a distance. Maybe it's a looser enforcement, but it's a self-respect for ourselves and for that other person. I also really strongly feel that the university working together with the town is really critical. And I think there ought to be a sense that when students leave the campus, that the rules don't suddenly change. And wow, you can have a different kind of behavior now because I have just crossed the street. On my street, we have a student house, and we had a COVID party back in May, and it went on for 3 days. And the behavior towards the residents, and especially towards families with children, was not acceptable. So I'm really hoping that the council will consider approving something that will encourage good behavior on the parts of everyone, and will encourage the focus being on getting our pre-K through 12 kids back in school safely, and our university kids in school safely. So whatever it takes to have the rules the same on campus as off campus would be the avenue that I would support. And thank you for letting me speak.
Thank you very much, Nancy. Ethan, and I apologize, go ahead.
Just so everybody
Ethan,
knows that Ethan is using an older version of Zoom, which will not work with our usual method. He will be temporarily promoted to being a panelist. That takes just a little bit longer to process through.
Okay, thank you.
Hello.
Hi, Ethan, how are you?
Good. Apologies. I'm yes, running an older version. I'm running on a Chromebook, so it works a little differently. But I wanted to comment.
I'm sorry, I think we lost him. Ethan, are you still there?
And kind of wondering how the town is coordinating their efforts with the university. I know that, as pointed out in a recent Bangor Daily News article, of party that was shut down, I think yesterday, and students were reprimanded for the party. And it seems, from my understanding of the article and of reading the student conduct book that the university has updated for this fall, they are taking health and safety measures very seriously. And within a few strikes, students can be suspended for not following guidelines. And so I'm hoping people can take that point into consideration in comparison to the town's efforts of $100, $200, and $500 fines compared to a suspension from the University of Maine, where the student does not get back refunds of their tuition money, which is thousands upon thousands of dollars. So my point being is that I feel, yes, there is a certain precaution we should take in certain concerns we might have with students returning, but the university has put into place very large incentives for students to follow proper safety guidelines. And if we want to compare numbers, it's in the thousands of dollars worth of considerations that students need to pay attention to.
Thank you very much. Sophie, you didn't?
I'm good. I have nothing else to add. I just wanted to bring that up. Thank you.
Thank you very much. I will just add that the university and the fire chief and town administration have been collaborating together. So it's been a great cooperation between the two. I do not see anybody else's hand up. So if there is no one else that wishes to speak, I will close the public hearing. And so I'm gonna close the public hearing. So at this point, at this point, I think then if we could.
We have a hand.
Council, but.
A hand.
Okay, Ron, do you have something to add to what you had already said? Ron, go ahead. Ron?
He's muted.
It says talking permitted. But... There you go.
Hear me now?
Yep. Go ahead.
On one of the notices that I received of today's council proceedings, there was the public hearing in the afternoon, and then there was mention that there would be an evening meeting. Is that when the council will actually be taking up selecting the ordinance and voting on it? And is that also open to the public? That's my question.
Actually, Ron, we are going to close the public hearing and then take the vote. There's no two separate meetings. So we'll be discussing it right after we finish with the public hearing.
So we can stick with you then through the rest of the proceedings, I gather.
Yes. Yep. We'll be doing that right now. Okay.
Could we have Belle stop screen share so we could see?
Yep.
Thank you. Thank you.
So I am wondering, so it looks like this is the results of the poll. Okay. I gotta move this so I can see you guys. So I'm thinking maybe that I could start with order 2136, and then after we motion and second that, we can have a discussion, and that may make other orders move faster, unless you've got another option.
Well, one option that could make it move even faster is if somebody makes a motion for the order and there is no second, it dies on the table. So if there truly is no support for a particular order, you don't have to go through the process of motion discussion and voting it down. That's up to you. But there's nothing that says it has to have a second.
Okay. My question was just, would council like to have, when would council like to be able to discuss this? Or do you want to just go through the orders?
I think we need to discuss.
Okay.
And can I say, this is really tough. This is a really hard decision, and I want to thank, I know people are still listening, and everyone that submitted written comment as well. You know, it's a passionate subject, and I think that, and really controversial. And we're really just trying to decide how best to serve our community. You know, and it's hard when there's so many different opinions. And I want to say too that, you know, the one thing, you know, while we have our listeners, that we all agree on, you know, that council always agrees on, is that we love Orono, and we love living here, and we love the people, and we love the surroundings, and we don't want to see anyone get hurt. You know, we don't want to see a teacher get infected. We don't want to see a 7-year-old get infected. We don't want to see an elderly person die because of a decision that we made. And
Cheryl, I'm gonna just stop you for a minute.
Okay, thank you.
I'm gonna ask that we take up Order 20-136, which this is the most restrictive, and we can then have a discussion about the ordinance. Order 20-136 is the order adopting an emergency ordinance requiring persons to wear face coverings in the town of Orono and requiring residential housing complexes to implement operation plans during the public health emergency and recovery, which requires facial coverings to be worn within the boundaries of the town of Orono in public places, including those located outdoors, businesses to enforce the wearing of masks on their property, and large residential complexes to submit and enforce approved plans for preventing and responding to the spread of COVID-19 on their properties, option A. So I will take a motion on this. All right, I hear no motion. So Order 20-136 does not get move forward. So we'll move on to Order 20-137. Order adopting, let me back up. So if I don't have a motion, do I have to take roll call? You're good with it? Okay. Order 20-137, order adopting an emergency ordinance regarding persons to wear face coverings in the town of Orono and requiring residential housing complexes to implement operation plans during the public health emergency and recovery, which requires facial coverings to be worn within the boundaries of the town of Orono in public spaces, including those located outdoors, with no requirement for businesses to enforce the wearing of masks on their property, and large residential complexes to submit and enforce approved plans for preventing and responding to the spread of COVID-19 on their properties, option B. I'll take a motion. No motion. So Order 20-137 does not move forward. Order 20-138, order adopting an emergency ordinance requiring persons to wear face coverings in the town of Orono and requiring residential housing complexes to implement operation plans during the public health emergency and recovery, which establishes specific areas in which wearing facial coverings are required to be worn in public spaces, including those located outdoors, businesses to enforce the wearing of masks on their property, and large residential complexes to submit and enforce approved plans for preventing and responding to the spread of COVID-19 on their properties, option C. I'll take a motion.
So moved.
Is there a second on Order 20-138? All right, having no second, we will move on to Order 20-139. Order adopting an emergency ordinance requiring persons to wear face coverings in the town of Orono and requiring residential housing complexes to implement operation plans during the public health and emergency and recovery, which requires facial coverings to be worn within the boundaries of the town of Orono in indoor public spaces, businesses to enforce the wearing of masks on their property, and large residential complexes to submit and enforce approved plans for preventing and responding to the spread of COVID-19 on their properties. Option D. I'll have a motion, please.
Move approval.
Second.
Second. All right. Discussion. Anyone wish to discuss this?
Yeah, I want to actually make the comment now about how I'm glad we're having these conversations because I think they're particularly important. And no matter what side, I'm actually was quite surprised at the number of people who came out to speak. I only add that when we do multi-million-dollar budgets for a town, that I would truly love the same people to come out and engage us about those kind of things also. So, because those are as equally important as a mask. So, but that's, yeah, I think this is great that the community kind of came together and wanted to really voice their opinion, and we'll see where this goes.
I think that one of the downsides of kind of doing this procedure the way that we did is that it's a strange way to not talk about some things, but I'm very much in favor of option D has all of the things that I want in it, minus I do still feel that zones with face coverings in outdoor areas, they're I think unseen things that we never talked about, and some other people who gave comment didn't mention either. I mean, we didn't talk through all the possibilities of how that could work outdoors. So I don't know, but I guess it's over now, so we can't. I do think that it's really important to give businesses the support that they might need to enforce or to feel like they have the ability to say when customers enter, listen, even if they have to say, sorry, it's not me, it's the town, we'll be the bad guy. Because I think it's really important to the public health and safety. And we've seen in the news every day especially indoors, of how quickly it can spread. I still do believe that having outdoor zones in highly trafficked areas is important, but if that's just me, then that's just me. But I appreciate everyone who came out today. And I echo Terry's comments. I'd love to see you all at more meetings. I love seeing you all and hearing from you.
Sam, I'm sorry, I don't mean to cut you off, but Sophie, did you have something to add?
I just wanted to respond, Megan, to your concern that this is all or nothing. And this is an up or down vote today. And I'm not trying to, as I have tried very hard through this whole process, I am not trying to tell you guys how to vote, because this is your decision. But if you were to vote through option D, which has 90% of what you like, but there is something else that becomes apparent that we should do, on 7 days notice, we can be right. So we could announce this in a week or a week and a half for next week's, for September's council meeting, if there was something you needed to add to the ordinance or a revision to this ordinance. This is, you can revise it after it has been adopted. You just have to go through this process again.
Thank you. Oh, I'm sorry, Sam, I cut Sam off, so I kind of.
Okay.
No, Tom, go ahead. Go ahead. I'll jump in later.
I'd just say I moved approval of option D because I think it addresses the areas of greatest concern. It is the option that is most easily enforceable. I especially like the section about the student complexes, the large complexes. I just think this is where we should be. Otherwise, we're going to be in an enforcement nightmare.
I agree with Tom, and just to let people know, we lost Megan again. She's been having terrible connectivity issues. So I think she'll be back shortly. I agree with Tom. I also just sort of echoing what Cheryl was saying earlier. This has been tough. I've lost more sleep about this than I've lost probably in the 6 years I've been on council about any issue about trying to get this right. I think this is incredibly important. And Leo asked some great questions about the numbers, and it is hard. I don't have a tally. I've talked with, I would say, dozens of people that either contacted me about this or had concerns about this, or concerns about, expressing concerns about the university. Is there anything the town can do? When people heard about this, that we're discussing and exploring the possibility of an emergency ordinance, I've had a lot of people say, this is great, and then how are we going to navigate it? So there has been, it wasn't 3, it wasn't single digits. I think we've all probably had quite a few. So I think there is enough to actually bring solid merit to this. I struggled with trying to figure out what to do. Well, I want the safe thing too. I want to help our community stay safe. You see statistics, I was in the New York Times the other day, which some people may question, but they're reporting that in municipalities and states throughout the nation who have, where they've been introducing mask mandates, the numbers of cases have dropped significantly. So, I mean, there will be evidence out there. I think we're seeing it. I think it'll take a while to compile it. And I think it will be, if we wait for all the data, it very well could be too late to do anything. I absolutely agree with Tom as far as the enforcement end of it. And Megan's comment also about supporting our businesses, making sure they know that we're behind them on this, that we do take it seriously. Also, the large complexes, that is an area of concern. And I was glad to hear Sophie's comments at the beginning of our meeting today about how they're starting to pay a little bit more attention to this. That's wonderful. Surprised, since we've all been talking about this since March, but at least that pulse is showing now. So yeah, and this is exactly why I seconded Tom's motion for option D.
Great, thanks, Sam. Anyone else wish to comment?
Can I finish?
Sure, I'm sorry. Sure.
What I was going to say. I think my other appeal would be to the community, because we don't want to send police out, and we don't want to do enforcing, and we don't want to fine people. And I mean, that just makes our community just an ugly place to live. But if we had help, if our community members could remind each other, or if you see students who are, are not masking, or who are forgetting to social distance, it would help a lot if we all acted together, in a way that keeps us safe and also keeps us healthy and happy. Like it would keep the stress down if we could all kind of chip in, and it's an easy thing to do. And while we have you all here on this public hearing, not to humiliate people, or to, although the humiliation signs that Megan mentioned might be pretty fun, but to the humorous ones, but to really just respect each other and to come together as a community. I think it would help a lot, and it would make me sleep at night. Like Sam said, I have troubles. I'm having trouble with this decision. So thank you to everyone who's participated. And it is tough. It's a strange historical time period right now. Thank you.
Anyone else wish to comment?
I'm sorry, I keep getting kicked off internet at my house. I live right near the center of town, and the service is terrible. I don't know why. I just want to finish my comment by saying thank you for that information, Sophie. I would want to very closely watch what happens with the university and with cases, and be able to, revisit the idea of whether heavily trafficked areas could be mask zones or face covering zones. Yes, not humiliating signs, Cheryl, humorous signs. But that was something that I've brought up a couple times as we've talked about this is that I do think that having some sort of ordinance in place does also empower people in the community to feel like it's okay to say, hey, listen, I'm not trying to be a jerk, but you're supposed to be wearing a mask, and I'd feel comfortable if you'd put one on. And I think that we can do this as a community together as well. And for folks, I definitely had some folks contact me and say kind of their fears of, you know, I'm walking in the woods and Orono police like jumps out of a bush and gives me a ticket. And I tried it. What I've been telling people is like, this will feel more like code enforcement than a traffic stop if it goes that far. So, you know, just to put people's fears at ease. And I'm sorry if someone already said that piece. I've been in and out of the internet, but.
Nobody said anything about jumping out of any bushes. I too have been wrestling with this. I think that residents have been very good when we've been, well, I walk around the university area and people are very good at moving off sidewalks or making 6 feet. And I do not want to make the students feel like we're targeting the students, but just the influx of thousands of individuals into a town, I just think it's important to take some sort of precautions. So that's kind of why I think this ordinance makes sense. I do appreciate everyone that sent emails and commented today that really helped inform my opinion as to what to do, and we really do take your comments into consideration. So anyone else have anything further to say before I take the vote?
I just have one more thing. I'm sorry, I don't know, Lori hasn't spoken yet. I know she has comments and I don't mean to jump ahead of you, Lori, I'm sorry. I was contacted by Sonia, who's now the new director of the Wilson Center. And she was, well, she supported this, but she also wanted to know if her students at the Wilson Center could help with creating signage and that sort of thing. I absolutely encourage that. And I think if other people want to do that, I think it's great just to increase that public awareness. I think that's a wonderful campaign. It can be grassroots, it can be local. I also think even if we don't pass an ordinance that requires people to wear masks in public, you still can. And I would encourage that. If that makes you feel better, do it. I do it. I've seen other people do it. I've seen other people on council. I've seen Lori the other day walking downtown wearing her mask, so it's like, do it if that's what you want to do. If you don't do it, fine, that's your decision, but don't mock other people and don't ridicule. I mean, this is just common sense. You know, and again, I just would like to see us go back to the mentality of the common good, which I think is a lacking thing these days. But anyway, just wanted to mention those two things. So cheers.
Thank you. Lori, did you want to say anything?
Yes, thanks, Sam. I was very impressed with how many people wrote in and commented and participated today. And I think that with this crisis, we're all spending more time. We know the community is spending more time watching us and also becoming engaged. And although we did have Terry, we did have the budget discussions since COVID happened. We were really on our way to discussing the budget, and maybe next year, if we're still in the situation, we'll have more people participating. So I want to thank everyone for participating. And I, as Sam said, I wear my mask, and I also walk around town, and people are very gracious about stepping away and holding up their shirt in the breathing zone. And I would like to see, I've said this before about getting town people involved in things. I would like to see a community organization, a community committee that was focused on public health. We used to have a public health nurse out. We don't have that anymore. I would love to see people who are interested in public health to, as Sonia just volunteered, to get involved, form a group, think of yourselves as people who would advise us, because we all want to make the town better, and we don't necessarily want to be punitive. We want to be educational. And so, or at least in my case, I'd like to see us be educational as opposed to punitive. And I don't want to put any more burden on the town for having to fine or quote police, or it's not police, code enforce these things. So I'm all for personally making the decision myself to wear a mask. I pull back from the idea that we would regulate mask wearing, but I do think that we as a town council should support community members to form a group that would then advise us, because the more input from the public, the better.
Great, thank you, Lori. Anyone else? Hearing none, I'll ask Sophie to take a roll call vote, please.
Councillor Coons,
I was hoping we would reverse the order tonight. In favor.
Councillor Osher,
Not in favor.
Councillor Perry,
In favor.
Councillor Maynard,
In favor?
Councillor Gardner,
In favor?
Councillor Grenier,
In favor.
Councillor Robertson.
In favor.
The motion passes 6-1 with Councillor Osher responding as the sole nay.
Hey, thank you. So we will get signage out for Order 20-139, which is option D. Thank you for everyone's hard work. We will go to the brief town manager report.
So I am on vacation this week, so it is a brief report. Staff has worked really hard. We have gateway signs up now talking about wash your hands, wear a mask, and stay 6 feet apart. We also have Bell screen sharing. This is what it looks like, the gateway sign. We also have pull signs up, which she is showing. There are 3 different versions of these signs, which she is showing now. We are going to look at the feedback we get from this, and we will adapt, add more, change, whatever we need to do as we kind of move forward.
Sophie, I'm sorry, where will those signs be? I know where the
So,
gateway signs will be.
Yeah, the gateway signs are where all the places that we had welcome to Orono signs. Just so you're aware, the welcome to Orono signs are covered at this point. They are covered with that gateway sign. And in some cases where we took down signs, we have new plywood up with those signs on them. The banners are, we tried to focus, we have 8 of each. So we've got 24 total of those signs, and we've got them on College Ave, Park Street, and downtown right now. There are some more that that are going up closer to the housing complexes on Park Street, but we need to get larger zip ties because of the size of the poles. So we'll see if they stay, what the reception is, if they're working, and if we need more, we will deal with it. So your feedback is always welcome on that.
Sophie?
Yeah?
Can I ask a question? Because it's probably so weird. On the current signage that's out there right now, there's a mask it or wear it or wash it. What's want it mean?
Want 6 feet of distance.
Oh, okay, because I was kind of trying to figure out what does want it mean?
Well, you could want lots of things, but in this particular case, we mean want 6 feet of distance. We were trying to come up with something more concise. So I just want to reinforce what I already said, but the communication with the University of Maine has just been outstanding. And my understanding is Josh got a call about the party from the media, and that wasn't even a party that the Orono Police Department had been called to break up. So the university is really taking things seriously, and they seem to be working closely with other entities, not just the Orono Police Department. And So they are doing exactly what they told us they would do. I also, earlier this week, I had a planning meeting with the city manager of Old Town and a few representatives from the university, including a representative from President Farini Mundy's office. We have scheduled a UMaine community public town hall that will be on September 2nd at 5:30. We'll start getting the message out, but City of Old Town will be on the panel. I will be on the panel, and some people in the know up on campus will be in the panel. We are looking at having it in a Zoom webinar format, but it actually goes out over YouTube, and there's a chat feature that the university is used to using. The idea is that there will be 5 to 7 minute presentations, and then the lion's share of the time will be set aside for community members to ask questions. This will be one of the opportunities I have to talk about the ordinance you just enacted, as an example. And I think that will do it for today, unless you guys have questions or concerns for me.
Sophie, after that town meeting on the 2nd, could that be put up on our website to be repeated, or?
I will ask them if we could keep that.
Or link it or something.
Yep.
And I just want to reiterate, the University of Maine, I dropped off Alex yesterday, and it was very efficient. There was like 5 bays of drive-through testing, and they had it all lined up, and all the kids were friendly, and they did the test, and you didn't get out of your car, and you went to your dorm, where he's been sitting for like 2 days, and like, because he can't go anywhere. But I was impressed. I was impressed with the efficiency, and it actually made me feel better that they are taking this so seriously, and really trying to impress the students that this is, this isn't anything to mess around with, and they weren't going to mess around with it. So yeah, I think they're doing a great job.
I'd like to.
Does anyone know what the color-coded bands actually mean? Like what colors mean what? Or I keep seeing people with bands or hearing about them.
Yellow was, I haven't got my COVID test back yet.
No, so
I'm not sure what pink was.
Each day got a different color. So pink was on Monday, yellow was on Tuesday.
Okay.
Red was today for Wednesday. They wear the bands until their test results come back, and they're supposed to wear them until their test results and their roommates' test results come back negative. I spent yesterday morning and this morning up in the parking lot at UMaine explaining that ad infinitum.
So if people on Tuesday saw folks with pink bands out eating in public restaurants, they shouldn't have been doing that then?
They should not have left campus, no.
Yeah.
Okay, take it all back.
I know. I will say what the university is doing the most right now, and I respect what they're doing. Again, it's like herding cats. It's like herding cats. When you're talking about that many people in this area, I mean, there's going to be all kinds of stuff going on. So I was just curious because I know that there were bans, but people keep texting me and saying, I see students with bands on. Is that a good thing or a bad thing? So I'm glad that that's out there. Okay.
I just had one quick question about how quickly we can implement getting masks to help businesses and that sort of thing with this new thing. I'm sure that's going to be on the to-do list pretty high up there, I'm sure. I just wanted to put that back out there again. And also, yes, I've been so impressed with the university with the coverage about it, what they're trying to do. Also, the coverage of some of the students out there who've been commenting about concerns of policing each other and that sort of thing. And just sort of reminding each other this is a big deal. But also, thank you, Sophie, and your staff, especially not to single people out, but I definitely know Chief Lowe and Rob St. Louis have been really instrumental in the effort on this, and to everybody else who's doing it. Just incredible gratitude. We're doing our best. Thank you.
To answer your question, Sam, I just got a text from my appointed mask procurer. He says he was already on it earlier today. So
Yeah, I also, before we close out, I wanted to also, Sophie, to say thank you. I mean, this has been a lot of work, and sometimes I know we had a lot of like public comments coming in. You've been navigating, sending us stuff, and it's not an easy gig. I mean, that's to keep us informed as well as keeping you informed, and a lot of people don't understand that the numbers that come through of different people asking. But I also just kind of like, because she's also my fitness guru, kind of like girl in my camp, I want to throw a shout out to Belle, because Belle does a lot of things that people don't see Belle's face, but she was instrumental in this whole process. So Belle, thank you so much.
Thank you, Terry.
Thank you all. So with that, I need to take a motion. Do you have anything more, Sophie?
want to remind people that we're flipping up the schedule a little bit next week. We have a workshop scheduled for Monday, and Thursday, I believe, is comp plan implementation. I think. I'll go back and I will get you, because we're into a new month, I will get you the final quarter of meeting schedule. Because of some conflict on council, meetings are now going to start at 4:30 unless I hear otherwise from folks. Please let me know before they get published if possible, because once it's published, it makes it more difficult to put that cat back in the box.
So Monday's meeting is at 4:30.
Talk with my comp plan implementation committee chair to make sure she is okay with Thursday, because the following Monday, she is great. So comp plan at 4:30 on Thursday the 3rd. And I do one of the items on the agenda is going to be the picking up the districts again, the medium density residential zone. I had a couple of thoughts on that and sent it out for a legal review to see if my thoughts were correct, so that I didn't open a can of worms that didn't need to be opened, but I was right. So we're gonna have to go back and do a little bit of work. I'll talk to you about it, Megan.
Well, with that, if there's nothing else.
But one more time, next meeting is when exactly? I heard Monday and Thursday.
Yes, Monday, Thursday next week. Monday is council workshop, and I will work with Cindy on what needs to go there. And Thursday is 4:30. 4:30. I thought you needed 4:30.
Yeah, I do.
All right. And then Thursday the 3rd at 4:30 is comp plan implementation.
Thank you.
But I'll give you the following Monday off because that's a holiday.
Labor Day. Thanks really much. But you won't give us off that Thursday.
No, that's finance and operations.
Right. Okay, with that, thank you all, counselors, for hanging in there, and this was a tough one. So
thank you all.
I will take a motion to adjourn.
So moved.
Second.
All right. Show of hands. All right. Take care, everyone.
Stay safe, everybody. Thank you.
Bye-bye.
Bye-bye.